We are just over 50 days out from the New South Wales election, and with the campaign still to fight, the Premier Dominic Perrottet is leading the charge on a number of proposed policy overhauls. This Friday, he'll take the task of health reform to National Cabinet, while debate over gambling reform saw the head of Clubs New South Wales lose his job over comments about the Premier's faith. With much on his plate, our political editor, Andrew Clennell, sat down with the New South Wales Premier a short time ago.
Well, Premier Perrottet, thank you for joining us.
Pleasure, Andrew. Good to see you.
So you're after this health reform deal with the Commonwealth. You want this to fund primary care for nurses and paramedics and to be executed jointly with the states, and you want a national rollout of free telehealth, pharmacy prescribing and urgent care clinics. Will the feds agree to this, and how much will it cost?
Well, I don't think we should start with the cost. We should start with the policy position, and it shouldn't be about state governments, territory governments going to the federal government, cap in hand, asking for money. What we've got to focus on as a country is having the best healthcare possible and a better integration between primary care and the GP network and the public health system. What we're seeing across the country are many people not being able to access a GP when and where they need one, and that's putting presentations into the emergency department. Just in New South Wales alone, close to 50% of emergency departments are patients who could see their GP. So Victoria and New South Wales have stepped up in terms of 25 urgent care clinics. That's not in our area of responsibility, but we know by integrating the systems better, we'll get better health outcomes right across the nation.
All right. Well, federal sources have told me they promised $750 million for this rollout of primary care to other areas at the election, and they are not going to promise you any more money in the middle of your election campaign. Any more money they would provide would go through their normal budget processes in May. Could that be a roadblock, particularly to reaching agreement Friday?
Funding shouldn't be a roadblock. Let's start with the best policy possible. So whether that investment in telehealth, once again largely in the federal government space, but we're doing a lot of work there as well. Pharmacy reform, which is occurring in Queensland and New South Wales, I think that should go nationwide. And also that better integration between GPs. And I'm more than happy to continue to invest in those urgent care clinics to ensure there's less pressure on the public health system. So I'm not going down to Canberra on Friday asking for funding. I'm asking for a better health system.
So you want the policy and we'll worry about funding later? That's what you're going to say to the PM?
I want a better roadmap in place which ensures we have a better health system right across the country. And I'm saying that from a position of strength. New South Wales has the strongest health system in the country. We saw that during COVID. Less waiting times here in our state, more patients being seen. But if we start with funding, we'll hit the roadblock straight away. Let's start with the policy and the principle and look at a way in which we would better integrate our health systems right across the country, and then we'll talk money.
But you can't guarantee the policy without the funding, can you?
Well, let's start with what's the best policy outcome, and if it's states and territories should step up to the plate. Absolutely, we all have a role and responsibility, and I think, and I'm very confident through the National Cabinet process, we've moved away from having the funding debates of COAG. We're actually working in a way that's collaborative to start with the outcome. The outcome is better patient treatment across the country.
Okay, is the strain on EDs, I know you spoke about the 50% that shouldn't be at EDs, I'm sure that's nearly always been the case, but is the strain on EDs a result of COVID? I remember doing
that's an element. There's no doubt that's an element.
Because I did an interview with you where I said, is this what, after the lockdowns, I think you'd just become Premier.
Right.
And you spoke about, well, 10,000 people are going to die from COVID. That's just the reality. It's actually less than that in New South Wales, right? But that's got to have its strains.
Well, I see it in hospitals I go to from Sydney to the bush. There is significant pressure on our emergency departments. There are still people presenting with COVID symptoms and the challenges that go with that. So there's no doubt all health systems across the country are still moving through this period of COVID, and that's why there should be a 50-50 funding arrangement in place. We'll have those discussions, but that's dealing with short-term issues. Let's deal with a long-term better health system across the country, and that's what I want to have the discussion on. And I'm making this point, Andrew, very clearly. I think the states and territories should continue to step up in places that generally aren't our natural responsibility, because we all have to work together on it.